Question 1. Patient safety emergency procedures. During a routine shift, you witness a patient collapse in the hallway and become unresponsive. The patient is not breathing and no pulse is detected. As a licensed practical nurse, what should be your first course of action? A. Call for help and begin chest compressions immediately. B. Deliver to rescue breaths before assessing for a pulse. C. Administer defibrillation immediately if a defibrillator is available. D. Place the patient in the recovery position and monitor for changes. Answer: A. Call for help and begin chest compressions immediately. Explanation: according to the American Heart Association (AHA) guidelines for basic life support (BLS), the first step in managing an unresponsive patient is to call for help and immediately initiate chest compressions at a rate of 100-120 compressions per minute. Rescue breaths and defibrillation come later in the sequence depending on the availability. Automated external defibrillator whether professional help has arrived. Placing the patient in the recovery position is only appropriate for someone who is breathing. Question 2. Scenario-based maternal and child health nursing. Labor and delivery. MS. Rodriguez, 28-year-old pregnant patient at 39 weeks gestation, is in active labor. She reports severe pain and requests an epidural. Shortly after the epidural is administered, her blood pressure drops significantly and she becomes dizzy and pale. What is the most appropriate nursing action? A. Administer oxygen at 10 liters per minute via face mask. B. Position the patient in high Fowler's position and monitor. C. Reassure the patient that this is normal response and continue monitoring. D. Turn the patient to her left side and notify the healthcare provider immediately. Answer: D. Turn the patient to her left side and notify the healthcare provider immediately. Explanation: a significant drop in blood pressure after an epidural is a common side effect caused by sympathetic blockade. Positioning the patient on her left side helps improve blood flow to the uterus and fetus by reducing pressure on the inferior vena cava. Administering oxygen may be necessary, but it is not the first step. High Fowler's position contraindicated as it could further compromise venous return. Reassuring the patient without intervention could lead to serious complications, including fetal distress. Question 3. Pharmacological nursing. Drug interactions. A patient is prescribed warfarin, Coumadin, for anticoagulation therapy. During a follow-up visit, the patient reports consuming large quantities of spinach daily. How might this dietary habit affect the patient's medication therapy? A. It increases the risk of bleeding by enhancing warfarin's effects. B. It neutralizes warfarin's effects, leading to an increased risk of clot formation. C. It has no significant impact on warfarin's efficacy. D. It reduces the risk of side effects associated with warfarin. Answer: B. It neutralizes warfarin's effects, leading to an increased risk of clot formation. Explanation: spinach is rich in vitamin K, which plays a critical role in clotting factor production. Warfarin works by inhibiting vitamin K-dependent clotting factors. Excessive intake of vitamin K-rich foods like spinach counteracts warfarin's anticoagulant effects, increasing the risk of clot formation. Monitoring the patient's inner normalized ratio inner and providing dietary education are crucial in such cases. Adjustments to the warfarin dose may also be necessary based on inner results and dietary habits. Question 4. Foundations of nursing infection control. A patient with tuberculosis (TB) is admitted to your unit. As the assigned LPN, what precautions should you implement to prevent the spread of the infection? A. Standard precautions only. B. Contact precautions with gloves and gown. C. Droplet precautions including a surgical mask for staff. D. Airborne precautions including an N respirator. Answer: D. Airborne precautions including an N respirator. Explanation: tuberculosis spreads via airborne particles, requiring airborne precautions to prevent transmission. Staff must wear an N respirator when entering the patient's room, and the patient should be placed in negative pressure room. Contact and droplet precautions are insufficient for TB. Standard precautions apply universally but are not specific to airborne pathogens. Question 5. Medical surgical nursing, pain management. A patient recovering from abdominal surgery reports a pain level of 8-10. The patient has an order for morphine sulfate 4 mg and ovary furrow ERN for pain. Before administering the medication, which assessment should the LPN prioritize? A. Assess the patient's respiratory rate and oxygen saturation. B. Determine the patient's bowel sounds and presence of gas. C. Check the patient's urine output over the past 4 hours. D. Assess the patient's blood pressure and heart rate. Answer A. Assess the patient's respiratory rate and oxygen saturation. Explanation. Morphine sulfate is an opioid analgesic that can cause respiratory depression as side effect. Assessing respiratory rate and oxygen saturation is critical to ensure the patient can safely receive the medication. Monitoring other parameters like bowel sounds, urine output, and blood pressure is important but not the priority before administering opioids. Question 6. Scenario-based mental health nursing. Crisis intervention. Mr. Turner, 45-year-old patient diagnosed with schizophrenia, begins shouting and pacing in the day room, appearing visibly agitated. He clenches his fists and refuses to speak with staff. What is the most appropriate nursing intervention? A. Call security immediately to restrain the patient. B. Encourage other patients to leave the area, then approach Mr. Turner calmly. C. Administer sedative without attempting verbal de-escalation. D. Stand at safe distance and firmly demand that Mr. Turner sit down. Answer B. Encourage other patients to leave the area and approach Mr. Turner calmly. Explanation. In mental health nursing, managing agitation involves prioritizing safety while using therapeutic communication and de-escalation techniques. Removing other patients reduces risk, while approaching Mr. Turner calmly shows empathy and respect. Resorting to restraint or medication without an attempt to de-escalate is contrary to best practices and exacerbate the situation. Demanding compliance could be perceived as confrontational and worsen agitation. Question 7. Maternal and child health nursing. Pediatric immunization. A 6-month-old infant is brought to the clinic for routine immunizations. Which vaccines are appropriate for administration at this visit? A. Hepatitis B, DTaP, Hib and rotavirus. B. MSAR, varicella, DTaP and rotavirus. C. Hepatitis A, Mimstip and varicella. D. Influenza, DTaP, Hib and varicella. Answer A. Hepatitis B, DTaP, Hib and rotavirus. Explanation. The CDC's recommended immunization schedule includes hepatitis B, DTaP, diphtheria, tetanus, and pertussis, Hib, Haemophilus influenzae type B, IF, inactivated poliovirus and rotavirus vaccines at 6 months. Varicella and hepatitis are given after 12 months. Influenza vaccination can begin at 6 months but is not grouped with varicella. Question 8. Pharmacological nursing. Adverse drug reactions. A patient receiving vancomycin Romnov develops flushing, itching, and redness of the upper body within minutes of administration. What is the most likely explanation for these symptoms? A. Anaphylaxis requiring immediate discontinuation of the drug. B. Red man syndrome caused by rapid infusion of vancomycin. C. Allergic reaction to vancomycin requiring epinephrine. D. Side effects of vancomycin that do not require intervention. Answer B. Red man syndrome caused by rapid infusion of vancomycin. Explanation. Red man syndrome is a histamine release reaction due to rapid vancomycin infusion. Slowing the infusion rate typically resolves the symptoms. Anaphylaxis is a severe allergic reaction that involves airway compromise, which is not described in this scenario. Allergic reactions often involve rash and hives and may require epinephrine. The symptoms here are not standard side effects but are preventable by proper infusion practices. Question 9. Gerontology nursing. Polypharmacy considerations. An 80-year-old patient on multiple medications reports dizziness and confusion. Is the LPN, what is your first priority in assessing the patient? A. Evaluate the patient's blood pressure and hydration status. B. Review the patient's medication list for potential interactions. C. Check the patient's blood glucose levels. D. Determine the patient's last meal time and nutritional intake. Answer B. Review the patient's medication list for potential interactions. Explanation. Polypharmacy increases the risk of adverse drug interactions in older adults, which can manifest as dizziness and confusion, while other factors like blood pressure, hydration, and glucose levels are relevant. Reviewing the medication list is the most logical first step in identifying potential drug-related issues. Question 10. Infection control. Vaccination guidelines. A healthcare worker experiences a needle stick injury from a patient who is hepatitis B positive. What is the recommended post-exposure prophylaxis (PEP) protocol for this situation? A. Administer 1 dose of hepatitis B vaccine immediately. B. Administer hepatitis B immune globulin HBIG and begin the hepatitis B vaccine series. C. Begin the hepatitis C vaccine series immediately. D. No prophylaxis is needed if the healthcare worker is asymptomatic. Answer B. Administer hepatitis B immune globulin HBIG and begin the hepatitis B vaccine series. Explanation. For a needle stick injury involving a hepatitis B positive patient, the CDC recommends administering HBIG for immediate passive immunity and starting the hepatitis B vaccine series if the healthcare worker is unvaccinated or has an unknown vaccination status. There is no hepatitis C vaccine. Wait. Symptoms is inappropriate as prophylaxis must be initiated promptly to be effective. Question 11. Patient safety fall prevention. An elderly patient with a history of falls is admitted to your unit. What is the most effective nursing intervention to reduce the risk of falls during their stay? A. Keep the bed in the lowest position and ensure the core light is within reach. B. Restrain the patient in bed to prevent accidental falls. C. Encourage the patient to ambulate independently to build confidence. D. Administer a sedative to keep the patient calm and stationary. Answer A. Keep the bed in the lowest position and ensure the core light is within reach. Explanation. The best fall prevention strategies include maintaining the bed in a low position, ensuring the core light is accessible, and promoting a safe environment. Restraining patients or using sedatives unnecessarily can increase risks of injury or complications. Encouraging independent ambulation without supervision is unsafe for a high risk. Question 12. Medical surgical nursing electrolyte imbalance. A patient with severe diarrhea has a potassium level of 3.0 meckel. Which clinical manifestation would the nurse most likely observe? A. Hyperactive reflexes and tetany. B. Muscle weakness and cardiac dysrhythmias. C. Confusion and decreased deep tendon reflexes. D. Dry skin and peripheral edema. Answer B. Muscle weakness and cardiac dysrhythmias. Explanation. Hypokalemia, low potassium, often leads to muscle weakness, cramps, and potentially life-threatening cardiac dysrhythmias due to the role of potassium in muscle and nerve function. Hyperactive reflexes and tetany are associated with hypocalcemia. Confusion and decreased reflexes may relate to other imbalances, such as hyponatremia. Question 13. Maternal and child health nursing postpartum care. A postpartum patient complains of severe pain and swelling of the perineal area. Upon inspection, you notice the firm, tender mass near the perineum. What should be your immediate action? A. Apply an ice pack to the area and reassess in 1 hour. B. Document the findings and inform the physician. C. Provide the patient with an analgesic and reposition her. D. Encourage the patient to ambulate to reduce swelling. Answer B. Document the findings and inform the physician. Explanation. The described symptoms and findings suggest a postpartum hematoma, which may require immediate medical evaluation. Applying ice and administering analgesics may help alleviate discomfort but do not address the underlying issue. Encouraging ambulation could worsen the condition. Question 14. Pharmacology. Anticoagulant therapy. A patient receiving warfarin, Coumadin therapy has an INR of 4.5. What should the nurse do? A. Administer vitamin K as prescribed. B. Encourage the patient to increase intake of green, leafy vegetables. C. Continue the current dose and monitor for signs of bleeding. D. Withhold the next dose and notify the healthcare provider. Answer D. Withhold the next dose and notify the healthcare provider. Explanation. An INR of 4.5 is above the therapeutic range, increasing the risk of bleeding. The next dose should be withheld, and the provider should be notified for further instructions. Administering vitamin K may be necessary if the risk of bleeding is high, but it requires a physician's order. Encouraging green vegetables may counteract warfarin, but is not an intervention. Question 15. Emergency nursing cardiac arrest. A patient collapses in the waiting room and is unresponsive with no pulse. What is the first action the nurse should take? A. Begin chest compressions immediately. B. Administer epinephrine. Check the patient's airway for obstruction. D. Call for help and retrieve an automated external defibrillator. E. Answer A. Begin chest compressions immediately. Explanation. High-quality chest compressions should be initiated immediately in a patient with cardiac arrest to maintain circulation while help and an EDA retrieved. While checking the airway is important, it should not delay compressions. Epinephrine is part of advanced life support but is not the first action. Question 16. Gerontology nursing polypharmacy considerations. An 85-year-old patient is prescribed 5 different medications for various chronic conditions. During the nurse's assessment, the patient reports confusion and dizziness. What is the most appropriate initial nursing intervention? A. Conduct. A thorough review of the patient's medications for potential interactions. B. Encourage the patient to continue taking all prescribed medications as directed. C. Administer sedative to calm the patient's confusion. D. Instruct the patient to stop taking one medication at a time to identify the cause. Answer A. Conduct a thorough review of the patient's medications for potential interactions. Explanation. Polypharmacy can lead to drug interactions and adverse effects, particularly in older adults. Detailed medication review helps identify potential issues. Stopping medications without medical advice can lead to serious complications, and administering sedatives without identifying the cause is inappropriate. Question 17. Infection control, sterilization techniques, and nurses preparing surgical instruments for an emergency procedure. Which sterilization method is most appropriate to ensure the instruments are safe for use? A. Soak the instruments in an antiseptic solution. B. Wipe the instruments with alcohol swabs. C. Use an autoclave for steam sterilization. D. Clean the instruments with soap and water. Answer. C. Use an autoclave for steam sterilization. Explanation. The autoclave provides high-pressure steam sterilization, effectively eliminating pathogens including bacteria and spores, which is essential for surgical procedures. Antiseptic solutions and alcohol swabs are insufficient for sterilization. Cleaning with soap and water is part of decontamination but does not sterilize instruments. Question 18. Scenario-based patient advocacy and ethics. Mrs. Patel, a terminally ill cancer patient, expresses her desire to discontinue treatment despite her family's insistence on continuing aggressive therapies. As the nurse, what is your best course of action? A. Respect Mrs. Patel's decision and advocate for her autonomy. B. Persuade Mrs. Patel to continue treatment for her family's sake. C. Arrange family meeting to convince Mrs. Patel to reconsider. D. Follow the family's wishes and continue aggressive treatment. Answer A. Respect Mrs. Patel's decision and advocate for her autonomy. Explanation. Patient autonomy is a fundamental ethical principle in nursing. Mrs. Patel has the right to make decisions about her care, including the refusal of treatment, as long as she is competent to do so. The nurse's role is to advocate for the patient, not to impose family or personal beliefs. Question 19. Maternal and child health nursing labor complications. During a delivery, a nurse notices that the umbilical cord is prolapsed. What is the priority intervention? A. Place the mother in Trendelenburg or knee chest position to relieve pressure on the cord. B. Immediately administer oxygen to the mother. C. Attempt to manually reposition the cord back into the uterus. D. Prepare the patient for immediate cesarean delivery without additional interventions. Answer A. Place the mother in Trendelenburg or knee chest position to relieve pressure on the cord. Explanation. A prolapsed umbilical cord can compromise fetal circulation. Positioning the mother to relieve pressure on the cord is the immediate priority. Oxygen may be helpful, but is secondary. Manually repositioning the cord is not recommended due to the risk of further injury. A cesarean delivery may be necessary, but requires preparation. Question 20. Mental health nursing. De-escalation techniques. A patient in a psychiatric unit becomes increasingly agitated, shouting and pacing. What is the most effective initial nursing response? A. Speak to the patient in a calm and non-threatening manner. B. Restrain the patient to prevent harm to themselves or others. C. Call for immediate security assistance to remove the patient. D. Administer a sedative without attempting verbal de-escalation. Answer A. Speak to the patient in a calm and non-threatening manner. Explanation. De-escalation begins with verbal techniques including a calm tone and non-threatening language to reduce agitation and prevent escalation. Restraints and sedatives are last resort measures used only if the patient poses an immediate danger. Calling security without trying verbal intervention can escalate the situation. Question 21. Pharmacological nursing medication interactions. A patient taking warfarin for anticoagulation therapy is prescribed an antibiotic. The nurse notes that the antibiotic is known to inhibit liver enzymes. What is the nurse's priority action? A. Educate the patient on the potential for increased bleeding and monitor for signs of hemorrhage. B. Advise the patient to stop the warfarin while taking the antibiotic. C. Increase the warfarin dose to maintain therapeutic inner levels. D. No action is required as antibiotics do not interfere with warfarin therapy. Answer A. Educate the patient on the potential for increased bleeding and monitor for signs of hemorrhage. Explanation. Antibiotics that inhibit liver enzymes can increase warfarin levels, elevating the risk of bleeding. Monitoring the patient's inner and observing for signs of hemorrhage are essential. Adjusting the dose or stopping medication without consulting provider is inappropriate. Question 22. Professional practice delegation and scope of practice. The nurse is assigning tasks to the nursing assistant. Which task is appropriate to delegate? A. Assessing a newly admitted patient. B. Monitoring vital signs of a stable post-operative patient. C. Administering oral medications to a patient. D. Developing a care plan for a patient with chronic illness. Answer B. Monitoring vital signs of a stable post-operative patient. Explanation. Delegation involves assigning tasks appropriate to the scope of practice of the individual. Monitoring vital signs in a stable patient falls within the null scope. Assessment, medication administration, and care planning require the expertise of licensed nurse. Question 23. Scenario-based emergency and critical care nursing. Mr. Lopez, a 60-year-old male, is admitted to the emergency department with symptoms of a myocardial infarction. He is pale, diaphoretic, and complains of severe chest pain radiating to his left arm. What should the nurse do first? A. Administer sublingual nitroglycerin as prescribed. B. Attach the patient to a cardiac monitor and obtain a 12-lead ECG. C. Provide emotional reassurance to reduce stress. D. Collect a detailed health history from the patient. Answer B. Attach the patient to a cardiac monitor and obtain a 12-lead ECG. Explanation. A 12-lead ECG is critical to diagnosing MI and determining appropriate interventions. While nitroglycerin administration and emotional support are essential, they follow after obtaining diagnostic information. A detailed health history can wait until the patient is stabilized. Question 24. Nutrition and diet. Specialized dietary needs. A patient with chronic kidney disease is being educated on dietary modifications. Which of the following foods should the patient avoid? A. Bananas and potatoes. B. White bread and rice. C. Apples and berries. D. Chicken breast and fish. Answer A. Bananas and potatoes. Explanation. Patients with chronic kidney disease often need to limit foods high in potassium, such as bananas and potatoes, to prevent hyperkalemia. White bread and rice are low in potassium, while apples, berries, chicken, and fish are generally safe in moderate amounts. Question 25. Maternal and child health nursing. Newborn care. A newborn is placed under a radiant warmer immediately after birth. The nurse notes the baby's temperature is 96.5 deg, 35.8 deg. What is the nurse's priority action? A. Continue monitoring the temperature and reassess in 15 minutes. B. Increase the temperature setting on the radiant warmer. C. Assess for signs of respiratory distress and hypoglycemia. D. Remove the baby from the warmer and place in skin-to-skin contact with the mother. Answer C. Assess for signs of respiratory distress and hypoglycemia. Explanation. Hypothermia in newborns can lead to complications such as respiratory distress and hypoglycemia. While adjusting the warmer or skin-to-skin contact may be necessary, the priority is assessing the baby for clinical signs and addressing any immediate complications. Monitoring without intervention risks further complications. Question 26. Gerontology nursing, polypharmacy management. An 82-year-old patient with multiple chronic conditions is taking 8 prescribed medications. The nurse observes signs of confusion and dizziness. What is the nurse's best initial action? A. Recommend stopping all medications until the patient's symptoms resolve. B. Conduct thorough medication reconciliation and consult the prescribing providers. C. Educate the patient on the potential side effects of polypharmacy. D. Schedule an appointment with pharmacist for medication review. Answer B. Conduct a thorough medication reconciliation and consult the prescribing providers. Explanation. Polypharmacy increases the risk of adverse drug interactions and side effects, especially in older adults. Medication reconciliation identifies potential issues such as duplication, interactions, or inappropriate dosages. Stopping all medications abruptly can be harmful, and while education and pharmacist consultation are valued, immediate provider consultation is critical. Question 27. Mental health nursing, crisis intervention. A patient with a history of major depressive disorder presents to the clinic expressing thoughts of self-harm but denies having a specific plan. What should the nurse do first? A. Notify the patient's family and provide them with mental health resources. B. Assess the patient's level of risk and initiate suicide precautions if needed. C. Schedule follow-up appointment with the patient's primary care provider. D. Encourage the patient to engage in relaxing activities to reduce stress. Answer B. Assess the patient's level of risk and initiate suicide precautions if needed. Explanation. The nurse must prioritize safety by assessing the level of risk for self-harm and taking steps to protect the patient. Suicide precautions, including constant observation or hospitalization, may be necessary. Involving the family or scheduling follow-ups can be secondary actions, but immediate safety takes precedence. Question 28. Scenario-based infection control and prevention MS. Carter, a nurse in a long-term care facility, notices that several residents in her unit have developed diarrhea and low-grade fevers. Stool tests confirm Clostridioides difficile C. Diff infection. What is the most appropriate infection control measure? A. Administer antibiotics to all residents as a preventive measure. B. Isolate infected residents and ensure staff adhere to contact precautions. C. Use alcohol-based hand sanitizers instead of hand washing to save time. D. Close the facility to new admissions until the outbreak resolves. Correct answer. B. Isolate infected residents and ensure staff adhere to contact precautions. Explanation. C. Disinfections require strict contact precautions, including wearing gloves and gowns and washing hands with soap and water. Alcohol-based sanitizers are ineffective. Isolating affected residents prevents further transmission. Preventive antibiotics are not recommended, and closing admissions is not routinely required unless directed by public health authorities. Question 29. Medical surgical nursing pain management. A patient recovering from abdominal surgery reports the pain level of a 10 and is prescribed both intravenous morphine and a heating pad. What should the nurse do first? A. Apply the heating pad to the patient's abdomen to relieve discomfort. B. Administer the prescribed morphine and reassess the pain level. C. Contact the provider to request additional pain management options. D. Encourage the patient to try relaxation techniques before administering medication. Answer. B. Administer the prescribed morphine and reassess the pain level. Explanation. Severe pain 8 and requires immediate intervention. Administering morphine as prescribed addresses the acute pain. Applying a heating pad could risk complications such as burns or altered perfusion. Non-pharmacologic measures and provider consultation are adjuncts but not primary responses for severe pain. Question 30. Community health nursing disaster preparedness during a community disaster drill. The nurse is assigned to triage victims using the START, simple triage and rapid treatment system. The patient is unconscious, has a respiratory rate of 35 breaths per minute and a capillary refill time of 4 seconds. How should the nurse categorize this patient? A. Green, minor injuries requiring delayed treatment. B. Yellow, non-life-threatening injuries requiring urgent care. C. Red, immediate treatment required to save life. D. Black, deceased or unlikely to survive despite intervention. Answer. C. Red, immediate treatment required to save life. Explanation. The START system prioritizes patients based on their condition, a respiratory rate over 30 breaths per minute, and delayed capillary refill. 2 seconds indicate life-threatening conditions requiring immediate intervention. Red tag. Patients with minor or delayed needs are categorized as green or yellow, and black indicates those who are deceased or beyond help.